health services, which is very, very important. You may take as an essay question regarding the school health services. Here, the school health services is an economical, powerful means of raising the community health in future generation. It is the raising the community health of the children that are they are the future generation. So this is the school health services. So the primary health center medical officer has chance to examine all the school children to know any defects or any diseases in the school children to raise the community health and in the for the future generation people. Here, if you see the historical development, the first time the medical examination of the schools was conducted in Baroda city in 1909, and later in 1953, Secondary Education Committee emphasized the need for medical examination of the people on the school feeding program. So it also leads to not only examination of the pupils to students, the school children, but also it requires the school feeding program. If the medical officer found that there is any defect malnutrition in the school children, so that requires the school feeding program. I will tell you how to do it, how to involve in the school feeding program. In 1960, the Government of India constituted a school health committee to assess the standards. Of course, it was also complaints. It was also continued as not only the examination of the students, but also we can assess the standards of the school also. That is regarding the school health program. Of course, in school health, what are the health problems, common health problems in children, school children? First and foremost one is malnutrition. You can see the children, those who are having the malnutrition and infectious diseases, intestinal parasites, diseases of the skin, eye and ear, and dental caries, etc. These are the five main problems in the school children: malnutrition, infectious diseases, intestinal parasites, disease of the skin, ear, eye, and dental caries. These are the main problems in the school children. So the main objective of school health program is promotion of positive health and prevention of diseases and early diagnosis, treatment, follow-up of the defects, and awakening the health consciousness in the children and the provision of healthful environment, etc. So the main objective of school health program is promotion of positive health in the children, prevention of diseases, and early diagnosis and treatment, and awakening the health consciousness in the school children, provision of healthful environment in the school, etc. So the aspects of school health services are that is health appraisal of school children and the health school personnel. So these are the school health aspects, school health services. First one is health appraisal of the school children and health school personnel, remedial measures and follow-up, prevention of communicable diseases, healthful school environment, nutritional services, first aid and emergency care, mental health, dental health, eye health, and health education, and education of the handicapped children, and proper maintenance and use of school health records, etc. So these are the main objectives under the school health program. The first one is health appraisal. So what is the health appraisal? Health appraisal means periodic medical examination of the all school children. That is the periodical medical examination. That means just just by before that is after entering into the school, the children should be examined thoroughly, and the school child should be examined once in at least once in 4 years. The periodic medical examination of the all school children. That means at the entry of the school, the child should be examined, and also it should be repeated every 4 years. And also health personnel, not only the school children, but also had to examine, the medical officer has to examine the school personnel, that is the teachers and also the other school personnels, those who are working in the schools. And daily morning inspection. Under the health appraisal, daily morning inspection means the class teacher is having, she is very checking the student, how he is. So, is there any defect in the child? That is flushing of the face. Is there any eye defect? That is a conjunctivitis. Is the child is having any fever? His child is dull, looking dull. His child is having any scabies, or child is having any pediculosis. Are there any skin infections and ringworm infections? All these generally daily morning inspection by the school teacher, because the school teacher is very well known regarding the student, how the child, how he is, and remedial measures and follow up. So the remedial measures and follow-up means the special clinics should be conducted exclusively for the school children at primary health centers. So the one day is allotted for the school, for the exclusively for the examination of the school children in all primary health centers in one of the selected schools or the dispensaries for about 5,000 children in urban areas. So there should be a separate clinic for the school children in primary health center or in one of the selected schools or the dispensaries for to examine 5,000 children in urban areas. And prevention of communicable diseases. Okay, you can prevent the communicable diseases by immunization against the communicable diseases in that area, and also the healthful school environment. The school environment should be healthful, that is, the location of the school. The school should be away from the railway tracks, away from the bus stands, it should be away from the cinema theaters, etc. And it should be reachable towards the roads, etc. That is the importance of the location of the school. The school environment is very, very important. And the site of the school means the school should be at least 10 acres for the higher education school, at least 5 acres for the primary schools, and 1 acre for 100 students. That is the
Oh,
site for the school environment. It should be like that. And if you see the structure, the school should have the separate one table and one bench like that, one chair, etc. The desk should be of a minus type, and it should be very convenient for the student to sit, and should be very convenient to the student to concentrate on it. And the classrooms should be in such a way that should be at least 10 square feet for each student, and should be 2 feet 6 inches above the ground level, and there should be a cross ventilation in all the classrooms, and inside the classroom should be the white coated lining in the inside the classroom, and the classroom should be in a white coated, and it should be every time should be uh, applied the white coat inside the room. And the furniture, there should be a separate table and the chair, as I already told. And the windows should be, there should be a cross ventilation in the classrooms, and windows should be narrow in the lower side, and they should be broader on the upper side, and it should be 2.5 feet above the ground level. And the color, as I told already, the color regarding the painting should be the white in color. There should be lighting, sufficient lighting. It is better to have the natural lighting rather than artificial one. So sufficient lighting should be there, and water supply, continuous water supply should be there for all the schools. Thereby, the students should have the sufficient water facilities for them, and eating facilities. There should be a separate midday meal programs, eating facility in all the schools, and lavatory facilities. So, for one urinals for the 60 students and the one lavatory for the 100 students in all the schools. That is the model of the school. And regarding the nutritional services, midday school meals should be provided at least one third of the daily caloric requirement and a half daily protein requirement of the child. So the midday meal school, that is, the school should be provided the midday meal. It should contains at least one third of the calories of the daily requirement and half of the daily protein requirement for the child, and applied nutritional program as the UNICEF suggested. The applied nutritional program means in the school land, if there is a separate place for the school land for growing the plants and the garden, etc., they should provide seeds and menus and the water supply requirement. Thereby, they can have the garden, and also the vegetable garden, those vegetables can be used for the midday meal. And the special nutrients, that is, especially the children, they are commonly seen the anemia and some areas goiter and the night blindness. These are the special nutrients. Those the children who are having the anemia, they have to provide the green leafy vegetables sufficiently so that we can prevent the anemia and goiter and the night blindness. And first aid and emergency care, that is a fully equipped first aid post should be provided. That is the first aid, they will have the training for all the school teachers how to tackle the first aid in the school children if the child had any fever or child had any injuries or child had any diarrhea, vomitings, etc. So the first aid training for all the school children, for all the teachers, before, when they are taking the training like teacher training, etc. And mental health, the juvenile delinquency, maladjustment, drug addiction, you can see in the children. So that is can be identified by the medical officer at the time of school health inspection, and sufficient relaxation for the students in the schools, and no distinction between the race, religion, community, rich, poor, clever, dull, etc. regarding in the schools. And dental health, dental caries and periodontal diseases are more common in school children. That is the main problem in the school children, dental caries and periodontal diseases. If you identify the dental caries, so the dental physician is having the chance to remove all the caries and give the treatment for the periodontal diseases, etc. Check up at least once in a year. And eye health services, that is, if the child is having any refractive errors, squint, amblyopia, they are to be referred the children to the nearest ophthalmic centers. Thereby, they can correct these problems. And health education, that is regarding the school children, regarding the personal hygiene, advised to take daily bath, change the dresses, etc., and environmental health and family life and etc. These are the health education regarding all these things, and the education of the handicapped children. So, and school health records. School health records should be maintained every time. So, whenever the medical officer uh, when inspect the school, they have to follow the school health records, how this child was previously. And school health administration, regarding the school health administration, the which primary hospital they are going looking after. So which medical officer from the PHC is coming for the examination of the children, and the school health committee, etc. That is regarding the school health program. So the second one is the handicapped children. So, what is meant to be an handicapped children? That is impairment. Any loss or abnormality of the psychological, physical, or anatomical structure or function is called impairment. So, in handicapped children, impairment means any loss or abnormality of psychological, physiological, or anatomical structure or function, and disability. Disability means lack of ability to perform an activity in a manner within the range of considered normal for a human being. That is called disability. Impairment means loss or abnormality of psychological, physical, or anatomical structure. Disability means lack of ability to perform an activity in a manner within the range of considered a normal human being. That is called the disability. Handicapped means a disadvantage for a given individual resulting from an impairment or disability that limits or prevents the fulfillment of role that is normal for that individual. That is called handicapped. Handicapped means it is a disadvantage for a given individual resulting from an impairment or disability that limits or prevents the fulfillment of the role that is normally an individual can do it. That is the handicap. So, problems of statement, if you see in the world, 83 million people are mentally retarded, and 42 million people are having hearing loss, and 10 million people have disability resulting from polio. And in India, 16.15 million persons are suffering from disabilities. If you see the classification of the handicap, we can call it as physically handicapped. Physically handicapped means if the child is born with any some birth defects, that is cleft palate, hair lip, talipes equinovarus, congenital heart diseases, these are comes under the disabilities and the infections. So infections itself leads to poliomyelitis itself leads to a handicap, accidents and road traffic accidents and burns, etc. And second one is mentally handicapped children. First one is physically handicapped children. Second one is mentally handicapped children. Here, mentally handicapped children means it is a condition of sub-average intellectual function combined with deficits in adaptive behavior. There is a deficit in adaptive behavior. The earliest term to recognize is to look for any delayed milestones. So, if there is any delayed milestones, we can call it as that the child was mentally handicapped. Maybe due to some of the causes, I will tell you regarding the what are the causes for mentally handicapped children. Genetic causes. Genetic causes is that is the Down syndrome, Klinefelter syndrome, and PKU, and Tay Sachs disease, galactosemia, and phenylketonuria, Tay Sachs disease, galactosemia, and microcephaly. These are the genetic disorders which leads to mentally handicapped children. And some of the antenatal factors. As I told already, the neural tubal defect, RH incompatibility, and some infections like toxic, toxic infections like rubella, cytomegalovirus, toxoplasmosis, and then syphilis, etc. These are the antenatal factors. And the perinatal factors means delivery, birth injuries, delivery during the any injuries to the baby during the delivery, birth injuries, or hypoxia, and cerebral palsy. These are all the perinatal factors. So the antenatal factor, perinatal factor, and postnatal factors. Postnatal factors are any head injuries, accidents, encephalitis, physical and chemical agents such as lead, mercury poisoning, etc. These are the these three main factors which leads to mentally handicapped children. And miscellaneous like maternal malnutrition, iodine deficiency, consanguineous marriages, and pregnancy after 40, that is elderly pregnancy, is leads for mentally handicapped children. So that is the categorical mental retardation. If you calculate the mental retardation, the intelligent quotient is mild means 50 to 70, 50 to 70 is the mild, and moderate means 35 to 49, and severe means 20 to 34 intelligent quotient. Profound means less than 20 is the intelligent quotient. So that is, we can categorize into mild, moderate, severe, and profound regarding the mental retardation. Great majority of the mental handicapped are mild type, and so these are the mental retardation intelligent quotient. The third one is, first one is the physical, second mental, and the third one is the socially handicapped children. It is defined as those whose opportunities for a healthy personality, development of a here, the social handicapped children means those whose opportunities for a healthy personality developed regarding the socially handicapped children. I will tell you regarding the what are the causes for the it is there. If you see the preventive measures in the handicapped children, the preventive measures are, first one is the genetic counseling. So here, genetic counseling means if the mother is having a consanguineous marriage, they are prone for mentally retarded children. If the mother is having the age more than 40 years, prone for mentally handicapped children. And if the mother is having less than 15 years of age, early pregnancy, late pregnancies are prone for the mentally handicapped children. So avoid all these things, and at-risk approach and immunization and nutrition. These are the preventive measures and the others. If you see the genetic counseling regarding the complications and the at-risk approach, and then that is regarding the deliveries. So risk approach means during the antenatal routine antenatal examination, and then the conducting the deliveries, normal deliveries, not exposed to hypoxia in the children. Any prevents the head injuries during the delivery. All these things. Immunization means correct in-time immunization to all the children. Thereby, we can prevent the complications and prevent handicapped children with poliomyelitis, DPT, etc., and then vitamin A deficiency by giving the vitamin A solution, etc. And the nutrition, sufficient nutritious food. So malnutrition children is prone for all these things. If even though the mother is malnourished, they are prone for giving the children of the malnourished children, etc. The secondary process of that is the approach, giving immunization, sufficient nutrition, we can prevent. That is the primary prevention. In the secondary prevention, early diagnosis and treatment. If the child is having any cleft lip or cleft palate, the child was diagnosed. How we can dilate direct at the time of delivery, you can identify that the child is having some congenital anomalies, like heart disease, like talipes equinovarus, or congenital hip disease, etc. They are all corrected in time if it is an early diagnosis and given sufficient treatment. So early diagnosis and treatment, and if the child is having any vitamin A deficiency, etc. Training and education, training and education to the individuals, and behavior problems. That is, problems are associated with nature. That is, sometimes in the schools, the children they are having the problems. That is, stealing, lying, gambling, cruelty, sexual offences, destructiveness, etc. These are all the behavior problems, and habit disorders. That is, the thumb sucking, nail biting, and then bed waiting. These are all the habit disorders, and the personality disorders. That is, jealousy, temper, timidity, shyness, daydreaming, fears, anxiety, unsociability, and hysterical manifestations, etc. And psychosomatic complaints, that is the tremors, headache, asthma, depression, delusions, and hallucinations. These are all the behavior problems in the children. So educational difficulties, school phobia. Some of the children will have the school phobia, and then failures and backwardness in the studies, etc. These are the educational difficulties. What are the preventive measures? Preventive measures means good social environment and education, educate the children regarding the regarding the how to stay in the classes and how to come, how their personal hygiene, etc., and improvement of the living conditions, and etc. The one word is called the juvenile delinquency. So you may get as a handicapped as an execution are the short notes, and juvenile delinquency is also a short notes. Here, juvenile delinquency means is the child who has committed an offense. Juvenile delinquency means there is the child who has committed an offense. Juvenile means a boy who has not attained the age of 16 years and a girl of 18 years. That is a juvenile. Juvenile means the boy who has not attained the age of 16 years and a girl at the age of 18 years is the delinquency. That is the juvenile period. So, what are the causes for juvenile delinquency? One is a biological causes. That is the abnormal chromosomal. That is the extra Y chromosome are prone for a juvenile delinquency. That is actually it is XY. So, in these children, if you observe, there will be XYY. That is extra Y chromosome, and that is the biological cause. The social cause is broken homes. Broken homes means is there any death of the mother or a death of the father, a separation of the parents, stepmothers, or a disturbed home conditions, poverty, alcoholism, parental negligence, ignorance about the child care, and many of the in the especially in the children. So these are the social causes which leads to juvenile delinquency. Other causes are absence of recreation facilities and urbanization. So they are having this some nowadays where everybody is having the internet, etc., looking for the some YouTube figure cinemas, etc., those which leads to juvenile delinquency. And then absence of recreation facility, the playing, etc., urbanization and industrialization, cinemas, televisions, etc., slum dwellings, etc. And preventive measures are improvement of the family life. First of all, you have to improve the family life. They should be having the much more care on the children. They should show the care on towards the child and the good schooling and the social welfare services, etc. And here there is another word called as battered baby syndrome. Commonly asked in the Viva, what is meant to be a battered baby syndrome? Battered baby syndrome means it is a clinical condition in young children that is less than 3 years of age who have received a non accidental injury on one or more occasions, including minimal as well as severe fatal injury trauma by an adult in a position of trust, either a parent, guardian, or a foster parent. That is battered baby syndrome. But the child who is less than 3 years of age, they have received a non-accidental injuries on one or more occasions, including the minimal or severe fatal trauma by an adult. That is called the battered baby syndrome. Here, there is a child abuse, which is the another word, that is the physical violence, sexual abuse in the child, mental and social maltreatment, etc. These are the child abuse. Child may be neglected child. It may be the deprivation of the child, where the parents are died, or the stepmother is taking care of them. And the consequences, if you see, mainly they may goes into death may occur. The child may goes into blindness. Sometimes, as we see in some of the pictures where you can see the children, they will make them to be blind for begging purpose, etc. And then mental and emotional retardation, stunting of the growth, loneliness, immaturity, alcohol and drug abuse in those children, which leads that is the consequences of the child abuse. And then remedial measures, provision of the support to home visitors, increased legal help, educating the young people to postpone having the children. The more number of children they are not taking care of much taking care or much care, love and affection towards the child, which itself leads to these very measures. And street children means the street children. There may be lack of nutrition in the street children. They are having the with mostly you can see the children who are not having the parents or the separated parents, or they are the child is having any the complications in the house. They will come out of the house and they will become the street children. These street children are more prone for malnutrition and tuberculosis and sexually transmitted diseases and parasitic and worm infestation. So for all these things, we are having a one program is called as a CRY. CRY means Child Relief and You. CRY means Child Relief and You, which was set up in 1979 by the Ripan Kapoor for all these children, those who are of, neglected by the parents, or those who are of having the love parents are not having the parents, etc. The child labor and legislation, there is a legislation towards the child. In 1973, ILO passed a convention establishing 15 as the minimum work age for most of the sectors while permitting the light work from the age 13. So they have established the age limit 15 years for the minimum work age for the child is 15 years, for the light work that is the 13 years, provided that such work was unlikely to harm the child's health, morale, and safety or prejudice for his school attendance. If you see the child marriage, it is a Sharda Act, it was conducted in 1929. The Child Marriage Restraint Act in 1978 raises the legal age of marriage from 15 to 18 years. Previously, it was 13 years of child marriages. So, in 1978, they have raised a legal age for marriage 15 to 18 years for girls and 18 to 21 years for boys. Now they have changed to now they have changed to 19 years for the girls and 24 years for the boys. That is the legal age for marriage. Child Guidance Clinic, that is, deals with the children or adolescents who are not fully adjusted to their environment. That is the Child Guidance Clinic. So in everywhere they will have a child guidance clinic where the children or the adolescents who are not fully adjusted to their environment, they will have the guidance. So it is a teamwork comprising of a psychiatrist, a clinical psychologist, an educational psychologist, speech therapist, occupational therapist, pediatrician, and a speech therapist, and then public health nurse. So, which consists of child guidance clinic. It deals with the children or adolescents who are not fully adjusted to their environment. So here the child guidance clinic consists, it is a teamwork which consists of a psychiatrist, a psychologist, educational psychologist or clinical psychologist, speech therapist, occupational therapist, and the pediatrician and public health nurse. That comes under the this one, and then they operate in the premises, that is the foundations of the mental health, and are laid in the childhood and adolescence in the same that will be continued in the adulthood. So they operated from the social foundations of the mental health which are laid in this childhood and adolescence. The same will continue in the that is the child guidance clinic. Child placement. So child placement where the child is not having the parents, and the child is suffering from the lack of care and protection from the stepmothers, etc. So they have to keep the children into the orphanages. Orphanages means those who are not having the parents, those either parents may be either in the form of a death of the parents, or they may be of separated parents. They will keep in the orphanages and the foster homes and adoption and the borsals and remand homes, etc. And the Children Act in 1960, it provides the care, maintenance, welfare, training, education, and rehabilitation of the delinquent child. So that is the Children Act in 1960. It provides the care of the children and maintenance of the child and welfare and training, education and rehabilitation of the delinquent child. Justice Act in 1986, it provides the uniform legal framework for juvenile justice in the country so as to ensure that no child is put in jail or police lockup, etc. That is, they are not supposed to keep it in the police lockup or keep it in the jails. And it envisages the specialized approach towards the prevention and treatment of the juvenile delinquency in keeping with the development of the needs of the children. So it established the norms and the standards for the administration of the juvenile justice in terms of investigation, care, and the treatment and rehabilitation of the child. It lays down the appropriate linkage and coordination between the formal system of justice and voluntary organization. That comes regarding the care of the child, either in the form of a school health or in the handicapped children or juvenile delinquency, and then Children's Act, etc. That ends regarding these programs. So, the next class I will continue the another topic. Thank you.